detail for your nursing and pharmacology notes on BCG vaccine for tuberculosis. Tuberculosis BCG vaccine full detailed drug information. 1. Generic name, drug class, brand name. Generic name, Bacillus CALMETTE-GUÉRIN vaccine, BCG vaccine. Drug class, live-attenuated bacterial vaccine. Immunizing agent, brand names depending on region, BCG vaccine SSI, Staten Serum Institute, Denmark. Tice BCG, Merck, used mainly for bladder cancer, not TB prevention. Immucyst, Canada, for bladder cancer. Oncotis, Europe. Local brands in Asia and Africa, commonly just called BCG vaccine. T2. Definition. The BCG vaccine is a live attenuated vaccine derived from a weakened strain of Mycobacterium bovis. It is one of the oldest vaccines still in use, developed in 1921 by CALMETTE-GUÉRIN. It is used to stimulate immunity against tuberculosis, TB. It does not prevent infection with Mycobacterium tuberculosis, but reduces risk of severe or disseminated TB, especially in infants and children, e.g. TB meningitis, miliary TB. Number 3. Mechanism of action. BCG contains a live attenuated strain of Mycobacterium bovis. When injected intradermally, it is taken up by macrophages presented to T lymphocytes, stimulates cell-mediated immunity, Th1 response, production of interferon gang, activation of macrophages, creates cross-protection against M. tuberculosis. Efficacy, prevents severe forms of TB in children 60 to 80%, provides variable protection 0 to 80% against pulmonary TB in adults. Duration, about 10 to 15 years. Protection may wane in adulthood. Number 4. Uses. Primary, prevention of tuberculosis in high-risk populations, especially newborns and children. Secondary, non-TB use, bladder cancer therapy, intravesical BCG, activates local immune response that destroys superficial bladder cancer cells. Investigated in leprosy prevention and immunotherapy for some cancers. Number 5. Indications. Routine immunization for newborns and children in countries with high TB prevalence. Children at high risk of TB exposure, household contact with TB patient, living in endemic area. WHO recommends a single dose as soon as possible after birth in endemic regions. Not routinely given in countries with low TB incidence, e.g. USA, most of Western Europe, unless special risk exists. Intravesical BCG for non-muscle invasive bladder cancer after transurethral resection, TUR. Number 6. Contraindications. Absolute contraindications. Immunocompromised persons, HIV infection with low CD4 counts, congenital immunodeficiency, organ transplant patients, those on chemotherapy or corticosteroids. Pregnant women. History of anaphylaxis to BCG vaccine or its components. Previous BCG vaccination. Active TB infection. Relative contraindications, acute febrile illness, severe skin conditions at injection site. Neonates weighing 2,000 grams, delay until weight is adequate. Number 7. Precautions. Before taking. Perform screening for immunodeficiency, SB-HIV in high prevalence areas. Avoid giving with other live vaccines unless on the same day. If not, space at least 4 weeks apart. Inform caregivers that a small local ulcer at injection site is expected and usually heals with a scar. Vaccinated individuals may show false positive tuberculin skin test, Mantoux test, but IgRA test remains reliable. Number 8. How to use. Route. Intradermal injection, not subcutaneous or intramuscular. Site. Left upper arm, insertion of the deltoid muscle, outer aspect. Procedure. Clean skin with antiseptic. Use special short bevel needle, 26 to 27G. Inject intradermally at a shallow angle, 5-15 degrees, until a raised wheal, 5 to 7 millimeters appears. Do not cover with bandage. Number 9. Dosing information. For TB prevention, neonates 12 months, 0.5 milliliters intradermally. Children 12 months and adults 0.1 milliliters intradermally. Usually single lifetime dose. Booster not recommended routinely. For bladder cancer intravesical use, 50 milligrams BCG diluted in saline, instilled into bladder via catheter, once weekly for 6 weeks induction. Followed by maintenance therapy. Missed dose and overdose. Missed dose for TB prevention, if not given at birth, can be given later as soon as possible before exposure. Overdose wrong administration, e.g. subcutaneous injection, can cause large ulcer, abscess, lymphadenitis. In immunocompromised, disseminated BCG infection, serious, life-threatening, may require anti-TB therapy, isoniazid rifampicin. Number 11. Stop or avoid taking. Do not administer further doses if severe allergic reaction occurred, Disseminated BCG disease develops. Patient becomes immunocompromised after vaccination. 12 side effects. Local effects. Mild pain, swelling, redness, small ulcer, 2 to 10 millimeters, heals in 2 to 6 months, leaving a characteristic scar. Regional effects. Lymphadenitis, swollen lymph nodes. Complications, rare, abscess at injection site, osteitis or osteomyelitis, 1 to 700,000 cases, disseminated BCG infection in immunodeficient, severe allergic reactions. Number 13, vital information, key facts. BCG is most effective in children, prevents severe TB forms, e.g. meningitis, miliary TB. Does not reliably prevent pulmonary TB in adults. Vaccination should be given intradermally only. Causes false positive MAN2 test. Use IGRA for TB diagnosis post-BCG. Protection wanes after 10 to 15 years, but no booster is generally recommended. Number 14, drug interactions, other drugs affecting BCG. Immunosuppressive drugs, e.g. corticosteroids, TNFi inhibitors, chemotherapy, biologics, reduce efficacy and increase risk of infection. Antitubercular drugs, isoniazid, rifampin, ethambutol, pyrazinamide, may inactivate BCG organisms if given around vaccination time. Other live vaccines, e.g. MMR, OPV, yellow fever, can be given on same day. If not, must wait 4 weeks between vaccinations. This covers the pharmacology plus immunization practice details. Thank you. Have a nice day.